We just had such a good podcast episode.
We actually really did. We had Dr. Emma,
a clinical psychologist.
She was phenomenal.
Talking all things school trauma, eating disorders, late diagnosis and more. This is one not to miss.
100%. Tune in.
Woohoo!
Welcome. We have Dr. Emma with us today. Thank you for joining us, Emma. Talk to us. Tell us about you, what you do.
So I'm a clinical psychologist and I work for myself. I'm self-employed. I have my own private service, which is a neuroaffirming service for neurodivergent individuals. And so we do a whole range of different services where we look at people's sensory profiling, we look at people's giftedness, we look at people's executive functioning. We like to look at all aspects of neurodivergence and kind of work with all ages and all different neurotypes.
Yeah.
So I can tell you a bit more about that, or I can tell you a bit more about sort of my kind of clinical psychology career.
Well, I think we'd love to hear both.
Yeah.
But I think what's a really interesting question to ask you is, when did you start your business and what got you into where you are today?
Yeah, so it was during lockdown, actually, where I really created this service. But the kind of breadcrumbs were already, I was following them already. And I'd started working privately and for the NHS. And it was in my private work that lots of people were showing up and saying, I've been going to therapy for years and nothing's changing for me. It kind of lasts for, say, a few months and then everything seems to go wrong again. And I was really noticing these patterns, and that's part of my neurodivergence, is pattern recognition. I was thinking, what's going on here for people? And one of the first things that really showed up as one of the patterns was a kind of OCD presentation in lots of people. And but they were working, they had families, so kind of not reaching what you would call as a clinical psychologist criteria for a disorder, which is a word I don't tend to use or believe in. I don't like the language of the medical model. Well, I'll use OCD if I have to for reports or to speak to other healthcare professionals. And if whoever's in front of me would like that term and is fine with that term, I just honour the person in front of me. But I don't believe in the idea of disordered human beings.
It just makes you sound like there's something wrong with you.
Well, yeah, you're out of the order of society is how I see the judgment being put on these people. So OCD was really showing up in people that kind of weren't getting recognised perhaps as displaying OCD because in terms of, severity, which is how the disorder and criteria is often measured, they weren't showing enough severity.
Well, it's interesting because we had Ollie who came on our podcast, and he has a diagnosis of OCD. And I think lots of us could probably agree, because we're not educated, that I always believe OCD was you're obsessed with cleaning, or you're obsessed with what's in your wardrobe or things like that. But really what he was explaining, and I think this is what you're coming to, is that the OCD is more what's going on in your brain and how you're functioning as a human being, rather than I need to clean my toilet 85 times and then it's clean.
Well, that's just a part of masking it, really, isn't it?
Yeah.
Well, this is the other part to this. These people who were coming to me privately were high masking. That's what I concluded in the end. And so for some of them, part of the OCD was their response to high masking. It was sort of how it manifested, because they were being part of society, and they were masking at work, and they were masking in different kind of social spaces. Then they would come home and their OCD would be, part of their regulation.
Yeah,
part of
in full force.
Yeah, exactly.
Yeah.
But then also there were other people showing up who had more sensory-driven OCD, which isn't really recognised.
Tell us more about that.
Yeah, so, and this is part of my profile, is sensory sensitivity. So for me, I have a high disgust response, and sensory sensitive to smells and to visual things. I have like high visual sensory sensitivity. So
How's the studio for you right now? It's very bright.
At first, I was a bit dizzy. Like my eyes were sort of going in and out. But it's okay because it's dim as well. If it were overhead and really, really bright, and it might be a bit much for me. But I might be a bit frazzled later. Actually.
Yeah.
So I will avoid things that trigger my disgust response from a visual and from a smell point of view, and that can become quite an obsessive thing and quite a compulsive way of avoiding or taking care of whatever I think, has, so some people might have more of a theme of contamination. Like if I touch that, I'm going to be diseased and that's going to contaminate me. I'd be more like, I can feel that on my hand, and until I can wash it off, I can actually feel something like that on my hand.
So you've got more of a feel rather than what's going on in your mind, because I'm actually I'm a germaphobe, so I can't feel the germs on me like you can. I just, in my head, head is saying go and wash your hands, because if you don't, then you're going to catch a bug, because that's my brain.
Exactly that. It's not really my head that's saying too much. My body is really feeling something has landed on it, and that's all I can concentrate on. So my selective attention is completely all over that sensation on my body. So that's very sensory. Yeah. But it's definitely linked, there are cognitive elements, but the dominant aspects are to do with sensory for me. So this is what I was seeing in other people. And again, that's not getting picked up by other assessing clinicians, because it's not maybe a kind of typical presentation.
It's not textbook.
Yeah, exactly. So all of these divergent people, I guess I would kind of call them, were showing up. And then lockdown happened, and I just hyper-focused. I just had so much time to study and to develop my service. And then I really started to notice my other neurodivergent traits.
Which are?
ADHD, and like I said earlier, a sprinkle of autism, I would say.
That sprinkle.
And I'd say I'm undiagnosed dyslexic.
So did you go and get the diagnosis for ADHD, or did you diagnose yourself? Can you diagnose yourself?
No, I've been diagnosed, but not for everything. Some things I'm able to do it myself at this point, and I'm quite confident in self-identification, and I believe in self-identification for many people as well. So I don't feel that I need that. But yes, I've been through, an official process, and I've also been through my own self-identification as well.
So explain to us then what's your diagnosis? What would you say to people if someone asked you?
I would say I'm neurodivergent.
Okay.
I
guess that's an umbrella, isn't it?
Yeah.
Of all the things underneath.
I don't think you need to label exactly what.
No, and I just feel very hybrid, and I always say this to people. My real belief, and this is what I see and this is what I live, is dynamic. So I can be with certain people, and actually I might kind of present in a more autistic identity kind of way. And at other times I'm with other people in other environments, and, I'm bouncing off the walls with energy and impulsivity and hyperactivity. And, I'm dynamic.
Sitting here today, I wouldn't say that I could see the hyperactive, like bouncing off the walls. I would say that you were more calm, content.
Yeah. I'm gripping my hands, and I'm trying not to sway. Like I keep wanting to sway.
I noticed a bit, and I'm like, you keep that mic still, lovely.
Yeah, I know. Don't sway. I must stop
you
it.
Can sway.
No, but it's really interesting you actually said that, because I always question it about Callie personally. So she will get a diagnosis of ADHD. I've been told without having the actual diagnosis, because it takes 85 years to get one, but that's fine. But in some environments, and I feel like you're the same with Bailey as well recently more, they can be in some environments and be like bouncing off the walls, not knowing if a building collapsed in front of them, just like in their own world, or in other environments be completely placid, not playing with any of their friends, being on their own, playing with a toy over and over again. It's like, how can you be one person in one setting and another in another setting? But you've kind of affirmed that to us now, that that's quite a typical way of a neurodivergent person.
Absolutely. There's continuity. Like we have reliable kind of traits and personalities that kind of, not entirely define us, but show up. And then we have these moving parts in and around us where we become dysregulated or regulated, or, it depends on the sensory environment, it depends on the demand of what we're being asked to do. It depends who's our safe people and who aren't our safe people. It depends how much sleep we've had or if we've eaten enough. The temperature, there's so many.
It's exhausting.
Yeah.
It sounds exhausting.
Yeah.
And so what I struggle with the most is actually, I will never know that answer because obviously Bailey Bow is non-verbal at the moment. So it's not like she can tell me that this is too overwhelming for me or, you know, mummy, I haven't slept enough, so that's why I'm feeling this way. So for me, personally, it's an absolute head fuck.
Absolutely.
Well, it's a complete guessing game, isn't it?
Yeah. But also, and you know, I don't know your full story or your daughter, so like whatever I say is kind of more general. But I think we're very disembodied in that we are brought up to think and to speak and not to pay enough attention to the body language. And so there is communication, isn't there, in other forms?
There is. Yeah.
But I also completely understand that you can't ask those direct questions or kind of drill down to get the information that you might need. But there are some.
There are other ways too, I suppose. It's just, as I say quite a lot, it's like I'm getting to know my child, even though she's 3.5, nearly 4. I don't fully know or understand her yet, and I think it's those little things. Whereas she might pull my hand like harder than usual, and that might be her way of communicating, "Get me out of here now." And it's just about learning those things that she does. So.
And you will.
Yeah, of course.
As years
I'm
get
sure
older,
I will. I mean,
you will.
I've only had this little human for 3.5 years. You know, I think we're probably trying to get to know each other and how each other work. Because as much as I probably find it hard to communicate with her, she probably finds it hard to communicate with me as well.
Yeah.
Yeah, that's a really good point. As a neurodivergent adult, just an interesting question. When you do need to regulate yourself and you're overwhelmed and you get home and blah, 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 do you know your triggers? Do you know why you're feeling overwhelmed? Because I'm really interested to know, because Callie, although she is verbal, she can't communicate. Say, you know what, Mum, there was so much going on at school today. I just need to sit in a quiet room now. Like I'll never know why. But as an adult, do you know why? Do you
Most of the time.
Yeah, that's good
time.
though.
Yeah, I mean, but also some of my triggers are my deep interests and hyperfocus. And so I actually often prioritize my hyperfocus and will burn myself out knowing I'm going to be burnt out and make these choices out of interest and excitement. And I'm kind of a walking disaster sometimes, and I know that's going to happen. And
do you know what I love? I love your honesty, because I feel the same. Yeah, and do you know what? But even with your job being what you do, you can assess people, you support people, and it's the same with me. I'm a life coach.
Yeah,
I'm the one that needs the therapy. And I feel like what you're saying as well, like you can be all over the place, but it's your job and you can support so many other people. But when it comes to yourself, we never put ourselves first, and we don't work on ourselves more than as much as we should.
Yeah,
it does sound like that you do give yourself like self-love and care.
I do.
And
I try.
Do prioritise.
I do, and I surround myself by safe people who, when I can't do it.
Yeah, and I feel like you wouldn't put yourself in positions that you know that you'd feel uncomfortable in. If you didn't have to, maybe. Am I wrong?
I'm always doing that.
Okay, forget that.
People are exasperated with me. Just, why do you keep doing that, Emma? It's like, it's interesting, or it's going to make a difference.
You want to learn.
Yeah, I couldn't sit with the energy of not doing something that I thought might influence life in a positive way for other people or for myself or for my family.
That's amazing.
I really burn myself out in the process, but you know, I do look after myself, and I do know what I can do to regulate most of the time.
That's really good.
Yeah, but it's amazing knowing that we're raising children that are still very young, that hopefully, please God, one day they will also be able to understand why they're feeling their ways and why they, you know, could go a bit crazy or melt down. Yeah. So that's quite reassuring.
Sure. So you, not that you target, because you don't target, but your target is more for diagnosis in the older generation.
So when I created my service, I just wanted it to be for all neurodivergent individuals, and kind of left it at that. Yeah, and trained in all areas. In
it just so happens.
Yeah.
It's been the...
people have sort of aligned themselves to my work, and that's what's changed my kind of Instagram. I can see people of a similar age, mums usually, late identified women with
why
neurodivergent
do you think they
kids.
are? Sorry to interrupt you. Why do you think... Because I don't think it's a trend. I don't think it's a trend, because that would be unfair, because women, men, they are suffering, and I truly believe that. Why do you think it's taken people so long You know, you think, you know, you've had 40 years. Yes, I'm sure you've had your absolute horrendous struggles, but why is it taking you this long to come forward and try and get a diagnosis and want to change it now?
So I think some of the roots of that are in how science is created and how we've come to reach these conclusions about what a disorder is. And autism, ADHD, the neurodivergent neurotypes are placed under disordered. They're in the Diagnostic Statistical Manual as a disorder. And so that research originally was on, young white males.
Yeah.
It's crazy,
and it was
isn't
built
it?
on the foundations of that. And there's a whole history that I couldn't recite if I tried, but there is a whole history that if you look into it, the science is flawed. The foundations of a lot of this have got lots of missing pieces. So there's some of that. What it's all built on has been stereotypes, or perhaps one presentation of a neurotype that does exist, but isn't everybody's experience. Yeah. And so there's been changes in research, a lot of research into women and girls, a lot of research into high masking individuals, a lot of research into, sensory experiences, just into physical health, like a neurodivergent body, what's going on in people's bodies that might be affecting their minds and vice versa. And so I think there's just this growing body of evidence. And that's what people aren't recognizing when they're putting this down to a trend. Are they reading the research?
No. Have you ever asked your patients, like, why now?
They usually come to me with that, and they're talking about it. And I'd say quite often they have a child who's being diagnosed.
That's exactly what I was going to say.
Yeah, it's the mirror. It's like, and in that household, that's how you do things. And so it wasn't standing out. It's not until you're in a different environment like school or other parents are sort of questioning what's happening for your child that you start to ask these questions, or people do. And that's when, for a lot of late identified people.
Yeah, because my husband, he won't mind me saying, he's not diagnosed ADHD, but when we took my eldest through the process of it, he saw so many similarities between himself and our son. And I think when he was younger, I think it was more brushed under the carpet by parents, maybe because there wasn't as much research, or I know that we always say you were labelled as just the naughty child, but he was very good at masking. My husband can play the game, be who he needs to be in that situation. He's very good at doing. Yeah. And I think that having your own child and seeing maybe that child isn't fitting in or isn't acting maybe the way that, all the other children are, I think that brought a lot back for him as well. And that's how he felt.
Do you think?
100% it's trauma from childhood.
Yeah.
And I think seeing the way that my son reacts to things, I think that brings back a lot to my husband, if that's the way he felt. But he thought maybe at the time it was normal to feel that way. And actually it's not.
Yeah. Well, I mean, a lot of people will mask. That's another reason for the late identification. But
a lot in women, right?
Yeah, but that's the question I was just about to ask. We always say that women mask. Men certainly mask. Like, why is it a term that it's a women thing and that females get diagnosed later on in life because they've masked throughout their whole life? Surely men do the same.
I think this is a changing narrative, but maybe the kind of whole socialization and expectation of gender roles.
I think it's the expectation and gender roles of the woman that we're meant to just be okay. Yeah. And that we've masked it, I suppose, more than men had to or have to.
Yeah.
Whether I think that's correct or not.
Exactly. We can find holes in all of these kind of concepts. But again, also then you can think about the research. Girls, women, were not researched. Yeah. And so I also believe in raising the female voice and, other kind of gender identifications as well. Because they haven't been researched and they haven't got that representation. And so they do need the representation, but not at the expense of boys, men don't mask. Yeah, of course 100%. They do.
Sure. But do you think with the research, like, it's going to be, I feel personally, it's going to be non-stop research because every case is different. Yeah. So how do you ever get to the end and think, okay, this is the final, this is the research, this is what we need to do. We've researched the shit out of everything. Because I don't think you can, because
good question.
Every child or adult is different and everyone shows different. and everyone's needs might be the same but are different because the spectrum is so wide. So when do you know what the answer? Do you understand what I'm trying to say? What the answer is when the research has reached its
ever going to be an answer.
I think as well we could shift that and think about researching people's intelligence or researching people's physical abilities. We don't put limits on that.
I think you need to research the individual.
Exactly.
Not the actual
But that's
diagnosis.
what's difficult when and again, no disrespect to you because I feel like we just spoke about this before. When most people go through like the NHS process and they see a paediatrician or a doctor, a clinical psychologist. Yay. They again, and I think that you that's why you've gone down your private role and you really cater to the individual. But if they are not, how many times have you seen people online say, "Oh, I went through this whole diagnosis, and at the end, the doctor said, well, he gave eye contact with me, so he's not autistic." So much,
I didn't know I was neurodivergent after becoming a doctor of clinical psychology, working in these services. But my story was of a young person who went to 14 different schools before she was 12 across, between Canada and England and all around these countries as well. So being different was put down to that.
Yeah.
And then, it just wasn't it wasn't the whole story, and it just became more and more, clear that there was different things going on for me. But in my training, I didn't identify at all because I was given this stereotypical.
Yeah. But do you not think, not taking away from anyone's diagnosis or anyone's ASD, whatever, do you think that I've noticed it maybe more being in the world of SEN now, do you think that you could pick out pieces of every individual and say, well, that's kind of like a neurodivergent
how people
trait.
say everyone's a little bit on the spectrum.
Like, do you not think that if you dig deep enough into every single human being, you will find something that is neurodivergent with them?
Yeah, so if you break down what is it to be autistic, ADHD, dyslexic, all these different neurotypes, there are identifiable experiences within the brain and the body and relationally that you can start to look at for themselves. An easy one to talk about is a sensory profile. Every single person has a sensory experience. And
100%. And some people don't like touching chalk, like loads of different
Is it whether it impacts your life is the reason why you would do something about it?
Yes. And I think we also have to remember in how it impacts people's lives when they're in certain environments. So in a different environment, like in the land of...
So obviously you're not saying this, but you're saying that in one environment I'm autistic and in another environment I might not be autistic.
I would describe myself in that way, this idea of being
Really?
dynamic and
Okay.
how like the different sensory elements of that environment, the different relational elements of that environment, the different demands of that environment may play to your strengths, and you might therefore come across in a particular way, or they might dysregulate you and you might be in overwhelm or be having a meltdown as a result. So I can go into meltdown, but I mask really well and people won't know, but it's very, very well hidden. And that's probably, you could call that a skill sometimes. It's not, it gets me by. But I can be regulated and dysregulated in different environments with different people.
I totally get that, because I actually could sit here and say that I think that I'm neurotypical, but I sometimes still get overwhelmed in big crowds. I look rude because I switch off and I go on my phone because I need to regulate myself. But does that make me have I
so understand what it's almost like saying, "Hi, doc, I hate touching cotton wool."
I can't deal with labels. I cannot touch a label. I mean, they make me physically vomit. Yeah, like those school. I can't even talk about it. I'm not going to discuss it. But does that mean that I have a sensory processing disorder? I don't know how far you can go with it.
Yeah.
Well, this is what the medical model was designed for, is to put these, so you have to reach a certain number of criteria. You have to have a certain impact on your life for this to be diagnosed as a disorder.
Makes more sense.
But I would also argue, but in a different environment, like the land of whatever we want to call it, if it was completely designed around my sensory profile and my executive functioning relational needs, then I would be the neurotypical predominant neurotype, and the predominant neurotype would actually be dysregulated and they would be considered disordered. So I do believe that there are elements of shifting and changing with this continuity of, actually there are some things that will, like, I'll always show up in a particular way.
Yeah.
but with all these moving parts around me.
And that's where I think the research should be researched on the individual and not as a spectrum.
Yeah. So
because everyone is different.
There are things such as case studies. You'll do research where it's one person or a small group of people, and it's called qualitative research, where you ask people rather than give them questionnaires and do some statistical analysis on this mass group.
Yeah.
But most research for medication, for therapies that are offered to develop services in the NHS will be mass research. So you've got very different extremes of research.
Yeah.
And if you're a researcher, you understand those kind of elements.
You kind of know what you're looking for.
You can't build a service in the NHS based on one case study.
Yeah, I totally agree with you.
But I'm with you.
Yeah, no, listen, I haven't ever kind of looked at it. So thank you like that. Like, you know.
Yeah, really interesting.
So it's really, really interesting. But moving on, we also wanted to speak about...
a couple of topics.
Yeah.
I think we should go with the school trauma topic. I think it's a big topic.
It's huge.
I feel like that's something that you're really involved
and passionate.
Yeah.
So tell us more, because, you know, for example, when I hear of school trauma, I hear of people have come on our podcast and they sent their neurodivergent child to a mainstream school and they've come out and they've had such trauma and now they're in their SEND school and they are like a different person.
Yeah.
Are you talking trauma that way, or...
Because when I think of trauma, I think I just want to homeschool my child. I don't want her going
So it's your trauma.
I think,
There's
that's
too.
my trauma.
Exactly. There's a whole spectrum of trauma. And, you know, I think many people might think of trauma as like a one-off event, say a car accident, something like that. And then afterwards, that person is frightened to go in the car. And that's kind of very sort of maybe easier to link than complex trauma or neurodivergent specific trauma. And so people I see... and when I started to really go into school trauma as like something I wanted to explore and talk with people about, where these families were coming to me and they had children who were like 7 years out of education, so traumatized by the systems and by professionals, they couldn't access anything because they couldn't be assessed, they couldn't see anybody, they wouldn't get out from underneath their bed for years, literally hiding underneath their bed if a tutor came over.
Is this because they were put in the wrong environment to start with, or they felt so isolated and they didn't get the love and the care, the support they needed? Is it all different things?
All kinds of different things contribute to that. So a bit like you're saying, each individual story, it could be shouted at, it could be shamed, humiliated.
And that's trauma for them.
Exactly.
It lasts
relational trauma.
But it also could be like a one word or a one sentence that can traumatize. I can tell you a story, and Josh won't mind me saying it because he's fully recovered. Yeah. But a teacher at school said, when it storms outside, God is very angry with you. Yeah. Until we had children 6 years ago, and I know this sounds really pathetic to most people, they wouldn't, because I'm trying to explain it. He had the most severe phobia of thunderstorms. Yeah. From one teacher saying one word, one line. Yeah. And lucky now he's got children. He's like, okay, I have to remove this phobia because I've got children and I have to move on from it. But
it's like Ted,
but film. Literally. But that's the sort of trauma that. But the scary thing is. Anyone can receive trauma.
Absolutely.
And it could be from one moment of the day.
Yeah. And I've seen, children with almost exactly the same situation, that one phrase, one word, or one tone of voice, or the way that a teacher, with all the care and goodwill in the world, didn't intend to,
of course.
Wasn't looking to traumatize anybody. But it's also in the response and the validation.
But maybe they weren't qualified in what they were doing. Maybe that child should have been in a SEN school where
I don't think Josh would have been entitled to a SEN school back in the day.
No,
just making an example. But even so, for someone that maybe just is quite overwired with his mind and his brain, that's something that's kept with him forever. But
so what do you do about, how do you help them? What do you do?
So I started doing school trauma assessments, which were neurodivergent specific. Yeah. So naming things like sensory trauma. You can have sensory, repetitive sensory experiences in school that are traumatizing, especially over time. So yes, it might be dysregulating once and then you recover. But if you are there every day, being exposed to things that are really dysregulating, and then having a response of don't be so dramatic, or hurry up, or you're going to get a detention for that because you're late, and you're actually, that child's trying to avoid a corridor because that's where the sensory trauma is. Yes. So when you're getting these like stacking effect of all these different traumas, so I wanted to advocate for neurodivergent specific trauma.
Yeah,
and so I started off doing these assessments and doing this detailed timeline and naming all these things, and then we send it off to the local authority and send it off to the NHS and schools. And I was getting calls from these services, and not a nice feeling when you are a professional yourself and they're questioning your integrity. And
I was just going to say, I'm sure they weren't very happy.
No, and it was terrifying for me to step forward and do that.
You should be really proud of yourself.
Thank you.
You really should. Because we need people like you.
Got to get out of the box
and
got to do
fight.
it. Yeah, exactly. Luckily, they listened.
Fantastic.
and responded to these families in ways that was helpful in the end. Not saying, right, you need a parenting course. It's like, please stop doing that. You're actually traumatizing.
Parenting courses get on my nerves.
I
have to do a parenting course for speech and language therapy. I have to listen to an hour-long thing and then write down what I want to happen.
And where does your energy need to go? Into your family and yourself, not
but
there.
I thought that's what the speech and language therapist was there to do. Why am I having to do the work?
It's baffling, but again, it's...
So do you think Bailey Bo's going through trauma at the moment at nursery?
I'll speak to the doctor.
My daughter cries the minute we drive down the road of her nursery every morning.
And then screams
going in and then sees us and screams coming out. Do you think there's trauma going on there?
I mean, I wouldn't want to say
no,
outright,
of course.
but
there's something.
It's a possibility.
But then how do I find that out when she can't communicate or speak to me
This is
about
where you have to go to the body and you have to look for the body communication. And there are, fight, flight, freeze, appease are, general examples or descriptions of a trauma response, a survival response. So you could look at a person's body. A lot of the work that I do is working with the body, trying to read the body.
Fascinating to actually talk about reading the body and not
because I kind of put it down to they put a lot of demands on her. My speech and language therapist, my private one, goes in there and gives them a program of what they need to follow to help Bailey. And I think she knows that. And I think for the next 3 hours, she knows that it's going to be quite hard, demanding work. That is what I think, because they're beautiful in there. They're lovely. Listen, they don't harm her. No. They don't, they don't do anything that's not with love and care. So do you think that could be it?
It could be.
But how am I going to know that, Emma?
Well, I think... So just sort of as a quick fire idea to this, I would be, if I were talking to you about this, I'd be saying, like, let's keep a log of her body, and you're literally trying to be a detective around this stuff. Yeah. And maybe an occupational therapist or people with different skills might track things differently to how I would, and they might make a better job of tracking certain things. But that's how I would do it. Is I would be. So I've had some training in embodied recovery. So I know some things to look for in somatic kind of expressions of survival responses. And like you might have fawning. So you might see, like the appeasing that I've given up the hopelessness in people's hands, or, the tension. Like I'm always in fights. I'm always
in fight. Sorry, on the way to nursery, she knows exactly where she's going. The panic on her face.
Awful.
Yeah. You can see her looking out the window. You can see her like holding it, trying to hold it together, and then all of a sudden it just. And I think, am I hurting my child more by sending?
Can I put my input in?
Please do, Soph.
I know, and you say it a million times, and I know you're coming out of it and understanding it more because we've been told by amazing people that come on our podcast.
Hell yeah.
Because she's nonverbal, you think, as I did too, she's in her own entire world and she doesn't know what is going on around her. You need to speak to her every day.
And actually, the last few days, I've actually said that she's more aware. This is why. Whereas before, she'd have the smile and she'd happy and she didn't know what was coming next. It's not a bad thing, but it's a harder thing because she's becoming more aware. Like at bedtime, she now cries at bedtime, whereas because she knows what's coming next. Whereas for the last 3 years, she hasn't.
So that's why visuals will probably be really good that you can. So what I was trying to say is, Mummy and Bailey are going to get dressed now, and we're going to go into the car, and we're going to nursery.
That's too many words.
But she'll pick up. But I'm whatever.
Mummy, car, nursery.
But just say, and then you tell her one-to-one's name.
I talk her through everything.
Fine, so she kind of knows where she's going. But do you think that
she's probably more aware? And I think maybe she's having her separation anxiety now.
See, these are all the elements that people don't. And trauma's a big word,
time.
isn't it? Right?
Yes.
When you hear trauma, you're thinking of, really serious things. And this is why I say neurodivergent specific trauma, because to someone else, that might be an enjoyable thing that is actually causing dysregulation.
How could that word offend you? How could that word offend you? Well, for neurodivergence, it does.
Yeah.
But how do we change this, especially in school environments?
Yeah.
Like, if there's any teachers on here or one-to-ones or anyone that are listening to this podcast and you've got this sensory processing child that isn't able just to walk from his classroom to the cafeteria, and without them saying, get there now or you're going to get a detention, what wording can they use to help this individual? Again, they're probably all individual wording that you can use, but how can they approach these individuals in a better way?
It's a big question.
Very big question.
Endless answers to some of that, and there is no one answer either. But for me, it's really validation and really believing that person's dysregulated, not inconvenient or defiant or all these different things. So it would be really putting a lot of faith and validation into that person. I really believe in co-regulation. So you're not there to fix a person or necessarily even to fix a situation that might be unfixable out of your hands, but you can certainly co-regulate and help that person come back down.
I like that.
To feel safe. It's all about safety for me. Like, how do you keep people feeling safe? So many neurodivergent individuals can be triggered in environments, but if they're relationally safe, they can tolerate it, and then they look after themselves after and resource. But if you're being triggered and you're not relationally safe, well then, that's where the trauma really starts to layer up, in my opinion.
Of course.
Yeah, no, that's really interesting. And again, this is why I think all of us have our own pages and stuff, and we're trying to educate so many people because every child is so individual. Everything's so going to be different for every single person, and the way things are said.
Understand it.
I think you do understand it.
I understand it, but I don't understand it, if that makes sense. I feel like I sometimes say what needs to be said because that's the right thing.
Yeah.
Whether I believe it or understand it is another thing.
But I think it's too dangerous to understand everything or think you do. We have to be responsive. We have to be able to think, there's going to be something I don't understand or I might need to respond differently to than this prescription in my head about this is how it is and this is what it is. That's what led us here in the first place. Yeah.
And the thing is, for one day, it could actually really work. And the next day, it's a bit like when you give your kids spaghetti bolognese and they lick the bowl clean. And then the next day they look at it as if you've given them mud.
Dog food.
Literally. So like it's all trial and error all the time. And it doesn't mean that you've cracked it because I don't think it's ever going to be cracked.
I think that's quite a typical thing as well, because with my other children as well, I mean, they would love something one day and hate it the next. And that's what I also find very difficult. Is this a neurodivergent situation, or is it my child just being a typical child within situations?
Yeah.
I find that really tricky.
Yeah.
Is it her autism, or is it her just being a 3-year-old?
Yeah. Well, that's why I like looking at traits, like what's happening in that brain body.
And I'm going to come see you, Emma. I mean, I've got questions coming out. Honestly, my brain comes blown up right
she's
now.
like, I'm booking you in. I'm seeing all of you. No, because you're so fascinating.
Knowledge is power, and I understand that. But sometimes too much knowledge in my brain does not work.
But if we reduce it, is this autism or is this neurotypical? We're just getting hooked on all or nothing kind of thinking. But if we're
labels.
What might be going on in this person's environment? What might be going on in their sensory world? Then we are asking like useful questions that really help us in that moment. Not to say is somebody autistic not a useful question, but in that moment, it's really, really important to try and navigate what's happening for that individual outside of this wider encompassing label.
I have a question.
I have a question too. Don't let me forget this question.
I won't let you forget it. But this is a question personally to myself. And obviously I understand you're going to give a generic answer. My daughter is non-stop. From the minute she opens her eyes, there is no downtime. There is routine. There is, I can't sit on the couch. There, she pulls me up. She leaves me there. If she's not hungry, we go to the kitchen. We go to the playroom. We walk on the climbing frame. We then go outside. She likes to go in the car. We walk around the house. We sit down. I have a bit of the phone, the TV. There's non-stop. What's that about? What can I do?
It could be a number of things.
Is she dysregulated? Is she overstimulated? What do I do?
It could be that, but she could be a movement seeker. She needs it for regulation.
She's not sensory, that's for sure. Yeah. She's not a sensory seeker.
But sensory seeking can be for pleasure and enjoyment. And
but how do I stop her? How do I get her just to sit for like 20 minutes
I know
and have
you
a
love
bit
your
of
chill
downtime?
time, but she just might not.
Is it forever?
I mean, she's in development, isn't she?
She's very young, and I forget that she's only
also,
3.5.
I know it's so exhausting. I know it's exhausting, but a year ago she didn't move.
Oh yeah, she didn't.
She didn't.
Yeah,
she didn't.
I know.
She used
and
to
it's so
sit there
funny
for
how the
hours.
brain works, because she wouldn't recognise me for a year or so, and I would be like, she doesn't know I'm her mum. She wouldn't care if I
She's
left
like,
her.
look
I
how
was in the
Callie's
room.
with you all the time. I said, believe
she
me.
doesn't leave me alone
What's
now.
she like
and
now?
I'm like, please just leave me alone for 5 minutes.
Yeah,
It's
I
the
know.
weirdest thing. But yes, I need her to slow down.
Yeah. Like hormones might be contributing. There's, that brain and body in development.
Is there a way of finding out what it is? That's the key.
Only with the best knowledge that we have in the moment at this time.
Maybe having someone come over and look at her and assess her and look at her body language.
So the question I have, it might be related. I'm getting my phone up because I shared a story about it yesterday, and then someone replied.
She's totally just cut me
to
out.
say, no, I'm not, because I think it's to do with the body. The question was, Callie now has her head to her shoulder, and her body looks like she's like a spaghetti. Like she can't stand up still. She's so unregulated within her body. Like it seems like she's uncomfortable. She's not in pain. She's not crying, but her body has to jolt and do what she needs to do
That's
to
a
kind
stim.
of. I don't think it's. Someone came back to me and said it's retained primitive reflexes.
What's that mean?
What does that mean?
I mean, that's not my area of expertise, but
is
I
it
have
like a
heard
physio?
of that.
Like it says here that it's very common in children who are neurodivergent. There are lots of exercises that can do to integrate them, but basically it's all to do with reflexes.
So I think, again, when I see like the best regulation and the best bringing of safety to a child, it's when you're bringing in lots of different voices. So it's not, do we just have a talking therapist? Do we just do somatic practice? Do we only work with an occupator? You can't, because it's dynamic and interacting, like everything interacts and kind of has this sort of escalation effect. So we all know if we have a really negative thought, like we might feel it in our body, but if my body's feeling really jittery, then my thoughts might start to be like match that. So like they're interacting and escalating. So you might need several approaches.
But this is what I'm saying about Bailey, why if she's on the move all the time, there must be. But then how can we afford every single therapy all the time?
I just want to know what I want to know the reason why.
And I'd also kind of want to know what it is that like you're concerned about in terms of her showing up in that way. Is it about risk to herself? Is it?
No,
is
if
she
I'm being
exhausting?
honest, it's
selfish.
It's you. It's me. I'm tired.
Yeah.
I'm pushing on.
Yeah.
You know, and she's not unhappy. She's not, and that's what I've got to understand. It's more, how can I let her just relax for 20 minutes so I can relax.
This is what I say about, but people say, oh, when I've made the kids dinner, at least I've got 20 minutes to sit down. My kids scoff their dinner in 0.3 seconds. So it's the same with you. Like there's no break. I'm like, my kids have never watched a movie in their life. Callie's nearly 6. She's never ever watched a movie. She's on YouTube, like skipping it every single second or repeating the same thing over and over and over again. There's no chill. And I just feel like it's a neurodivergent thing, babes. I don't think there's any answer to it.
Yeah.
Apart from it's exhausting for us as parents.
Well, but we can hold compassion for each other and for ourselves about that, because it's true. It is exhausting.
It really is.
And it's really hard to stay that co-regulated parent and to spot what they might need when you've got no resource. Yeah.
It's exactly that, Emma. It's exactly that.
We need to ask you one more topic, and
sure.
I know it's going to be just a snippet, but hopefully we can have you back on the show again, and then we can go through it into more. But you also mentioned that you focus and work a lot with children and adults that suffer with eating disorders. Would you call an eating disorder an addiction? I guess so. Is it an addiction, or maybe not?
Well, I mean, some people would kind of experience it like that or describe it like that. Again, it's a very individual experience. And this is the thing, we call something an eating disorder, but each person has got completely different reasons for why they are there, and that relationship to food or to their body or to society in that way. So eating disorder can be described in many different ways. But I do see a lot of this. One group that I think is often missed are the high masking neurodivergent individuals who maybe are in school, maybe they are actually finding that an eating disorder is is what manifests as a result of that high masking and being within school and what they have to do in order to stay in school and to master be in school, then their relationship to food is...
I think it's a form of control.
To some degree.
That's what they can control what comes in and out of their mouth, whereas they can't always control what's going on in their head.
Yeah.
To some degree. I think as well, other things like perfectionism starts to become part of the mask in order to be accepted and liked and validated and to not be seen for what's underneath. Then I'm going to, that's going to be my strategy, is going to perfect everything. So perfect how I look, maybe... start to judge food as well. And so there's lots of complex layers. I also see lots of sensory sensitivity and OCD within that eating disorder presentation. So the school canteen is the most sensory assault most people can experience. The smell, the noise, like the high disgust response of like, is that clean? The cutlery, just all kinds of things. And so for a lot of children I work with who are in school, experiencing eating disorders and OCD, they don't eat at school. They don't want to use the toilet. So they don't eat, so they don't have to use the toilet. And so that starts to build up as an eating disorder. Effect. Yeah, so the layers of complexity that end up manifesting as what we'd call an eating disorder have got all these neurodivergent traits building up of people trying to stay sometimes in an environment like school. Yeah. And that's just one example, really.
Do you see the other end of the eating disorder spectrum in regards to... My daughter, Callie, loves her food and her favourite place is the cafeteria. She wants to work in the cafeteria when she's older in a school because she absolutely loves food. But hers is on the other end. Like, she can't wait to get into the cafeteria. They have to stop her from going up over and over again to get all the food. Yeah. And obviously she's got autism. Also you can
get her to places if you tell her that there's food.
That's my only way of getting her out of the house. Or you're going to get an ice cream or go and see your nana and she'll get you a big ice cream later. You're so right. So do you see it from that end of the would you call it a spectrum? I don't know that.
Yeah. I mean, in terms of a relationship to food,
sure.
Then we can kind of look at all different areas, can't we? I've not worked so much with younger people, although that's been kind of present for a lot of them, but that's not perhaps what the focus has been of the work. It's maybe been somewhere else. Enough. But what I do see is a lot of late identified women who come to me with this has sort of been ongoing from a young age, and now they're coming to me for shame work. They feel so ashamed that they can't break that cycle. And it's both a regulation cycle, it's an emotional regulation cycle. It's, something that is almost like habitual. They're not even thinking about it. They kind of say that they find themselves, they've got out of bed, they've come downstairs and they've started eating, and then they're sort of like...
I do that in the middle of the night, I eat.
Yeah, you do.
Yeah.
I wake up in the middle of the night and I go downstairs and eat.
Yeah.
And why?
But I think you need to see Dr. Emma. I'm joking.
But then there's also the other side of it of because some people are so sensitive to foods, they can't physically eat them and they have eating disorders because of that as well. Absolutely.
This to me is such a missing link for a lot of people. And we see this with the neurodivergent body, people who've got, say their microbiome or their gut health and things like that, or just how their body receives and digests food might play a part in an eating disorder where they start to choose safe food because their body isn't triggered, they're not getting all these horrible symptoms.
Or is it chosen food?
Well, Vanessa called it same food rather than safe.
Yeah.
Which I understand in both ways, but
I know this food is not going to,
exactly.
I can trust it, kind of thing. Yeah.
Trust food.
Would you? Well, I know I don't know whether this is a completely crazy question to ask. Would you say that lots of people that do have eating disorders may be neurodivergent because of their sensitivities and ways of processing?
Not always.
Because it's interesting, or would you say that people, because of social media and now everyone wants to look the way they want? I don't think I could ever, this again, I'm just saying it out there, I don't think I could ever have an eating disorder because I think I would do it for a day. That's how my brain works. I'll do on 1,200 calories a day, tomorrow I'll eat a whole pizza. Do you think it's your brain is wired to have a full-on different relationship with food, or is it something that you can just develop even as a typical human?
Again, I think it really depends. There's so many protective factors, moderating factors, things that happen in between your wiring and how these, how these things sort of grow and manifest. But what I would say is that it hasn't been enough research on neurodivergence and eating disorders, and that is really emerging now. So I think the percentage or estimation is a lot lower than it actually is, but not everyone experiencing an eating disorder.
I personally think this is a whole nother podcast.
Yes, it is.
I really do, because I have obviously so many questions about eating, and I think it is so broad, as in to do with OCD, to do with to do with neurodivergent, to do with addiction, to do with control. I think that's a whole nother podcast, which I would love for you to come back and come on, help us and talk about, because that's something that I'm really interested in. But on that note, we are so pleased you came.
Time flies.
I mean, I've had a ball.
Oh, thank you so much for having me. I've really enjoyed it.
Thank you. And do you know what? Keep doing what you're doing.
You're amazing.
We need more people like you in the world.
Thank you.
Thanks,
Thank
Emma.
you.